Deputy Walsh,
maybe just bring one thing to the attention of the Minister, and it's just going back to in relation to the increase in places for medicine. In particular, I have concerns from postgraduate students who did their Leaving Cert, say, in 2019. I know I had a communication from one who got eight H1s in 2019 Leaving Cert, and they feel because of the lack of spaces that they'll be at a severe disadvantage if there is to be a points inflation for this year. And I think in light of the pandemic and our demands in terms of public health and all of that, and our need to educate doctors and more clinicians and medical people, we really need to ensure that we are not putting barriers in place and that we're doing everything that we possibly can to invest in those extra places so that those who did the Leaving Cert even in prior years to 20 and 21 aren't at a disadvantage, that we're not excluding them. Thank you very much, Cathaoirleach, for letting me in.
Can I just say, Chairman, I think Deputy Conway-Walsh makes an important point. There's two parts to my answer. The first thing I would say is I agree with her that we possibly have an opportunity as a country now to have a conversation about how do we make sure we're producing enough graduates to provide the level of public services that our citizens will expect and deserve post-COVID. And that's one of the reasons why my department is working not just in our own silo, but is also engaging with other government departments to ask the question if it is possible for a university to provide an additional college place for medicine. Is it possible for a hospital to provide an additional clinical placement to match that? So I do want to assure the Deputy that those conversations are underway. The Taoiseach and every member of government has been clear that financial resources won't be a constraint in terms of expanding the number of places. But I do have to be honest with the committee that there are issues other than financial constraints that can be challenging, and that's what we're working our way through. And then the second part, I suppose, of the answer is that fact that we are pulling people together to engage with the department, all of the stakeholders. I'm expecting to receive a report back from that work in the month of April. I'll then bring it to government, seek any additional funding that might be required for any further places we can provide, and we'll be more than happy to share our thinking, our rationale and our workings with the committee at that stage.
Thank you very much, Minister.